In this chapter, you will learn about the techniques for inserting the sensor of the iFree CGM system. If you are wearing it for the first time, we recommend using a mirror or asking others for assistance. Wash and dry your hands. Choose an insertion skin site on the back of the upper arm, where there is an adequate amount of subcutaneous fat. If needed, consider shaving the insertion area of excess hair to help the sensor stick properly to the skin. If you are having difficulty inserting the sensor onto the back of your upper arm by yourself, ask someone to help you, or use a mirror for assistance. Wipe the insertion site with an alcohol wipe. Wait for approximately 2 minutes until the insertion site has dried. Follow 3 simple steps of wearing iFree CGM. Step 1. Open the sensor kit. Step 2. Position the inserter properly and press down firmly. Step 3. Attach the transmitter. Open the sensor kit package by peeling off the sealing paper completely. Take out the sensor kit from its package and peel off the plastic film outside the sensor kit. Open the sensor kit cap. The adhesive patch does not have a paper cover and is ready for application immediately after opening the cap. Make sure the arrow mark is pointed upward to ensure the sensor location. Here are tips for comfortable sensor application. Step 1. Use arrow to direct. Position with the arrow by pointing it toward your shoulder, parallel to your upper arm to ensure complete attachment of the adhesive patch on your skin. Step 2. Simulate position and ensure direction. The forward arrow is directed to shoulder and the sensor is placed parallel with upper arm. Step 3. Press down firmly and wait for 10 seconds. Position the sensor inserter over the disinfected location, with the arrow pointing toward your shoulder, parallel to your upper arm. Gently apply the inserter over the desired area. Press down firmly and wait 10 seconds for the adhesive to adhere. Gently move the inserter away from insertion site. Here are tips for attaching the transmitter after the sensor is inserted. 1. Align the alignment notch of the transmitter and the sensor base. 2. The transmitter needs to be pressed down firmly to ensure insertion. Note that there is no hard needle at this time, and there will be no pain. 3. Press the transmitter down into the sensor base until you hear 2 click sounds. Align the edge of the transmitter and the edge of the sensor base. Put the transmitter along the edge of the sensor. Then, press the transmitter down until it clicks into the sensor base with 2 click sounds. Make sure all 4 corners of the transmitter are secured in the sensor base. Ensure the sensor adhesive patch is fully attached to the skin. Recap the used inserter by aligning both notches on the inserter body and the cap. Discard it according to local regulations for sharps and blood-containing components. After ensuring that the sensor and transmitter are correctly installed, tap Connect. Your smartphone will automatically search for the transmitter. Keep the smartphone close to you after the connection is established. The system will display the warm-up complete time. Once the warm-up is complete, perform calibration.